Components of psychosocial health. Psychosocial health is a new term to comprehend the already established factors involved in mental health and psychological well-being. The term was not specifically defined and explained within the framework of psychology, until a recent study conducted by Dr. Sukoon, who regarded psychosocial health as an umbrella term for several themes of psychology such as happiness, satisfaction with life, mental health, mental well-being, mental wellness, quality of life, etc. Psychosocial health has not been specifically defined and explained within the framework of psychology. The philosophical roots for psychosocial health can be traced throughout history. Starting from Aristotle, who considered happiness as the only rational goal in a human's life, several theorists have proposed ideas which can be interlinked with the modern concept of psychosocial health. Satisfaction with life is a well-studied phenomenon in this regard. It has been regarded as the fulfillment of the purpose of life, the gratification of human needs, a match between hoped for and achieved goals, a comparison between goals and accomplishments, the fulfillment of a person's important desires, the gratification of a person's needs, an accomplishment of a person's life expectations, an evaluation of the life as a whole, and a subjective criterion. Satisfaction with life depends on several psychosocial factors such as physical health of a person, healthy family relations, extraversion in personality, optimism for future, being married, sexual satisfaction, body image, financial stability, and job satisfaction. Psychological well-being or wellness is another important theme that contributes to the concept of psychosocial health. Psychological well-being is a multi-dimensional framework and has been regarded more than the mere absence of psychological problems. It has been thought as the capacity of a person to attain full growth, to work effectively and creatively, to build positive strong relationships, to adapt socially well, and to serve the community. It is the possession of higher levels of positive personal attributes and lesser levels of adverse behaviors. It is more a process than an outcome. Quality of life is also an interlinked phenomenon which has been regarded as the possession of a good living environment, a perception of a person regarding his position in life with respect to culture and value system he lives in, as well as with respect to his goals, expectations, standards, and concerns. Personal relationships, health status, and sexual activity are the strong predictors of the quality of life. Mental health is quite a famous term in modern times. It is, however, considered quite confusing and has been mostly defined as the absence of psychopathologies. The concept of mental health also includes several psychosocial aspects such as effective functioning in a social context. Evidence suggests that the concepts of happiness, satisfaction with life, well-being, wellness, quality of life, and mental health are used interchangeably. Besides the interactive nature of these concepts, several theorists have elaborated on the components and models of psychosocial well-being and mental health. These models include sets of elements or domains involved in understanding the broader concepts of psychosocial well-being such as zest, resolution, congruence, self-concept, and mood tone, comprising a model, self-acceptance, positive relations with others, personal growth, purpose in life, environmental mastery, and autonomy, comprising a model, happiness, quality of life, positive effect, self-acceptance, personal growth, purpose and meaning, environmental mastery, personal control, positive relations, and morale, comprising a model. Satisfaction of human needs as a model, competence, relatedness, and autonomy, comprising a model, mental, physical, social, and environmental well-being, comprising a model, mental, emotional, social, physical, economic, cultural, and spiritual health, comprising a model, positive affect, emotional awareness, emotional regulation, interpersonal communication, and personal adaptation, comprising a model, inter- and intrapersonal domains, comprising a model, and so forth. Globalization and the massive spread of information technology have been changing the patterns of human socialization. People are getting more and more connected and concerned with each other. The social aspects of human life, therefore, have been heavily affecting the psychological well-being and mental health. social comparison, public opinion, self-evaluation, inferiority and superiority complexes, quality of relationships, social environment, social events, social integration, social acceptance, social actualization, social coherence, social contribution, social satisfaction, and fear of missing out in social media engagement all have been established contributors in one's psychosocial health. Psychosocial health is comparatively a new label which was not well elaborated by psychologists. The study by Dr. Sukoon evolved the concept of psychosocial health by a comprehension of the similar earlier concepts such as mental health, psychological well-being, satisfaction with life, quality of life, etc. The study, based on a thorough literature review, proposed a model for psychosocial health comprising of 8 components or domains which are sexual, emotional, cognitive, social, environmental, religious, moral, and spiritual. The statistical treatments resulted in the valid approval of these components for psychosocial health except merging social and environmental health together as a single factor. The study involved 3,999 participants in total and performed a step-by-step evaluation of the reliability and validity of the proposed model. Principal component analysis, exploratory factor analysis, and confirmatory factor analysis all confirmed the model and its instrument is sufficiently reliable and valid. The proposed model of psychosocial health is positively linked with the similar earlier concepts. The 8 proposed and validated domains of psychosocial health have also been significantly correlated in the earlier studies, though by different titles. The label of psychosocial health can be a better replacement for similar concepts such as mental health, mental well-being, mental wellness, happiness, psychological well-being, psychological wellness, satisfaction with life, quality of life, etc., as these can be interchangeably applied. The sexual, emotional, cognitive, socio-environmental, religious, moral, and spiritual domains all have been regarded important contributing factors for a person's psychological well-being. The additional findings of the same study revealed significantly higher levels of psychosocial health among women as compared to men. Most of the earlier studies conducted to measure psychopathology among men and women found women to be more inclined towards mental disorders. This needs to be probed further by future researchers to analyze the differences in women's mental health if assessed from a psychosocial perspective. As there are no earlier studies available in the specific context of psychosocial health, future studies would be able to elaborate more in this regard. Another interesting finding of the current study suggested that the levels of psychosocial health decrease by age with an only exemption of the sexual domain. Earlier studies have already emphasized the highly significant role of sexual satisfaction in mental health and psychological well-being. Future researchers, therefore, are suggested to investigate the predicting role of sexual health in the overall psychosocial health. The additional findings of the current study suggest future researchers, especially the positive psychologists, to identify and debate on the methodology of diagnosing psychological problems and measuring psychological well-being. Thanks for listening. To read the entire paper, kindly visit www.dersakoon.info.